We'll call our first witness this morning, Dr. Martin Tobin.
Man, what the hell happened to the incompetent cross-examination of that woman that processed the car? That should have been the cross-examination of the year. Why was there no cross from the defense? Somebody try to find that and put it in the comments on why he didn't cross her.
Do you swear or affirm under penalty of perjury that the testimony you're about to give will be the truth and nothing but the truth?
I do.
Seat, please.
Damn, dude, water, suitcase, you're not moving in, you're just testifying. I did his grocery shopping on the way to the court.
And doctor, if you wouldn't mind removing your mask for your testimony. Yep. And also, to make sure the microphone is properly placed, we're going to have you state your full name, spelling each of your names.
Martin Tobin, M.A.
Hey, they must be watching my videos. Some Ray Charles dude moved the microphone on the side of the jury so he could look at the jury when he's talking and be in the microphone. Brilliant.
A-R-T-I-N.
Good morning, Dr. Tobin.
Good morning, Mr. Blackwell.
Would you tell us what's your current employment?
I am a physician in pulmonary and critical care
God, this
medicine
guy talks slow.
And whereabouts?
in Chicago at Hines VA Hospital and Loyola University Medical School.
And is Hines VA Hospital a large facility?
It used to be the largest VA hospital in the country. I think it's now been superseded by one or two others.
And you specialize in pulmonology?
Man, he said a VA hospital. He lost credibility right there. They got the worst doctors in the freaking world.
I specialize in pulmonology and in critical care medicine.
Would you tell the jury what pulmonology is?
Pulmonology is the study of the lungs. It deals with all diseases that affect the respiratory system. So the lungs, the chest wall.
So what are the various elements, components of the respiratory system other than the lungs and chest wall?
I mean, the respiratory system begins at the nose and the mouth. It goes down through the back of the throat, down through the windpipe, out through the bronchial tubes, and then down at the bottom down to the alveolar air sacs. These are the small grape-like structures at the bottom where all the gas exchange takes place, where oxygen gets in and carbon dioxide is removed.
So this is the system for getting oxygen into the body.
Correct. That is the prime purpose, for to get oxygen in.
Now at Hines Hospital, do you work in the intensive care unit?
Yes, I work in the medical intensive care unit.
And that's considered critical care?
Same as critical care. These words all have the same meaning.
Is critical care different from emergency medicine?
Yes, it's very different than emergency medicine. Emergency medicine is kind of the front door of the hospital. That is a triage area where you separate out where people need to go, whereas the critical care is where you take the very, very sickest people.
Now, if he's in a critical care unit, I mean, and his answers are sounding pretty good. He kind of lost me when he said he worked at a VA, though.
What kind of patients do you see in the ICU?
In the ICU, probably more than half of them are patients who are requiring mechanical ventilation, so they're on a respirator to help them with their breathing. Then another substantial number will not be on a respirator, but their primary problems relates to their lungs, so that might make up 70% or so. And then the remaining patients will have drug overdoses, alcohol withdrawal, diabetic coma, sepsis, things like that.
Do you only see the patients in need of respiratory care?
No, once they come into the ICU, they're our patients. I'm the primary care physician for everybody who comes into the ICU.
And how long have you been a physician, sir?
I've been a physician for 3 months short of 46 years, so over 45 years.
And where did you go to school?
I went to medical school in Dublin, Ireland, and I took my degree there.
Not that anybody noticed the accent, but but are you from Dublin?
No, I'm not from Dublin. I'm from a small village called Freshford in County Kilkenny in rural Ireland.
What degrees do you hold?
I'm sorry?
What degrees?
The degree I hold is the MB degree, which is the Irish equivalent of the American MD, and then subsequently I got an MD through research.
Are you currently licensed?
Yes, I'm licensed in the state of Illinois. In the past I was licensed in Ireland and England and a number of US states, but I've let them all lapse because the only place I'm practicing is in Illinois.
Are you board certified?
Yes, I'm board certified in internal medicine, pulmonary medicine and critical care medicine.
So you still are actively caring for patients.
Yes, I was taking care of patients in the ICU last week, and on Monday I go straight back into the ICU again.
How long have you held positions at Loyola University School of Medicine?
I've been at Loyola and Hines for 32 years almost.
Before going to Loyola, were you practicing medicine somewhere else?
Yep, I spent 7 years at the University of Texas at Houston.
Did you also set up a sleep clinic in Houston?
Yes, I did. That would have been in the early 80s, so I set up one of the very first sleep labs in the United States for evaluating patients with obstructive sleep apnea.
So how do sleep disorders fit within your expertise?
Because this is related again to breathing and the problems with sleep, particularly people who snore. And the people who snore during the nighttime, they occlude their upper airway and they can totally stop breathing 500, 600 times a night, and during that time the level of oxygen in their blood will go very low. And the basic problem in sleep apnea is because the soft palate, I mean, the roof of your mouth is your hard palate, and then just if you look in the mirror, it's that little piece that's hanging down at the back, and that's your soft palate and uvula, and that jams in against the back of your throat and it gets occluded 500 times a night in somebody who has sleep apnea.
And does that kind of research or science or medicine relate to your work in this case?
Yes, it's extremely pertinent to the case of Mr. Floyd, because obviously in sleep apnea the problem is at the back of the throat, and as we will see in Mr. Floyd, the central problem of where the obstruction is occurring is in the hypopharynx, which is again at the back of the throat. So it has an awful lot of overlap to patients with sleep apnea.
We'll come back to the hypopharynx in a little bit. Are you also engaged in medical research?
I'm sorry?
Are you also engaged in medical research?
Yes, I've been doing medical research since the early 80s, since about 1981.
What kind of research have you been doing?
All of my research is related basically to breathing. So it is kind of looking at breathing in patients with lung disease, people who have lung disease who walk in the door to the clinic, and also patients who are in the ICU, and particularly patients who are requiring mechanical ventilation. But then I do a lot of research that has absolutely nothing to do with clinical medicine, just to know how people breathe.
Have you authored a textbook on the subject of ventilation?
Yes, I've authored a large textbook on mechanical ventilation that's called The Principles and Practice of Mechanical Ventilation.
So am I showing the cover of your textbook? So am I showing the cover of your textbook here on the camera? Is this the book you're referring to?
That is correct.
1,500 pages.
Correct, 1,500 pages, yeah.
Are you familiar with the Lancet, Lancet medical
Yeah.
journal?
Yes, the Lancet is one of the top medical journals in the world.
And does the Lancet medical journal refer to this book as the Bible on mechanical ventilation?
Yes, it has called it that.
Have you authored other books also?
Yes, I am.
This guy should be a big COVID dude, because this is what's supposedly killing everybody. If he's the expert, why weren't they asking him questions about COVID?
Roughly how many?
I think I've published 8 or 9 other books.
And all related to respiration or respiratory failure?
Correct, they're all on different aspects of the lungs.
Have you published articles and abstracts also?
Yes, I have.
Approximately how many of those?
I lose count, but I think I've published more than 750 probably, or something like that.
Published in the New England Journal of Medicine?
Yes, I've published several articles in the New England Journal of Medicine.
The Journal of the American Medical Association?
Yes, likewise.
Are those two of the most respected medical journals in the world?
They are for clinical work, yes.
Have you also held editor positions at medical journals?
Yes, I was editor-in-chief of the journal called the American Journal of Respiratory and Critical Care Medicine. So that's the premier journal in the world.
And did you vote for Hillary Clinton? Oh, never mind. Sorry.
For all lung disease. It's also the premier journal in the world for intensive care medicine. And it's the official journal of the American Thoracic Society.
Have you taught and lectured outside of Illinois and or Texas?
Yes. In 30 different countries around the world. And probably
Trying to
the
bump
vast
forward to
majority.
this.
I've lectured in
Were you given an award from the...
clinic. It could be around neurosurgery, gynecology, whatever. They just pick one person every 10 years.
And was it for anything in particular that you were recognized by the Mayo Clinic?
No, just for my
Published in Basic Science.
work on basic science that wouldn't necessarily be directly related to what are really the mechanisms that
Focus or interest you have?
band your chest and how you overcome forces within your chest, like resistance within your chest and all the rest of it, to get air moving in and out of your lungs, and then the particular forces that you generate in terms of the pressures within your chest that will enable breathing to occur, with the ultimate purpose of getting oxygen in and getting rid of carbon dioxide.
And do you consider this a part of the study of medicine?
It's not quite as part of the study of medicine. It's really quite separate, because it's more the basic physiology. So it's more in the realm of math and physics. But then it's applied over, because to be a good doctor you need to have a good knowledge of science. But the science part is really separate from the medical part, and it's to try and hone down on the science as best as possible.
How long have you been working in respiratory physiology?
Since 1990, directed, I had spent to breathe. And I thought it would be fun to find a lot of new stuff.
Physiology for 46 years. Change subject and talk a little bit about your experience of work as serving as an expert.
Oh my God.
Have you served as an expert witness before?
Yes, I have.
What types of cases?
Of oxygen. So all of this is just really other words for a phenomenon that is a low level of oxygen.
Have you formed an opinion to a reasonable degree of medical certainty as to what the cause is or was for the low level of oxygen in Mr. Floyd?
Oh,
Floyd died from a low level of oxygen. And this, when I was asked to do the case, I thought I might have some knowledge that would be helpful to explain how Mr. Floyd died. And since I'd never done this type of work in this nature before, I decided I didn't wish to be paid for it.
So did you volunteer to the state of Minnesota, or did the state of Minnesota call you?
The state of Minnesota contacted me.
What were you asked to do, Dr. Tobin?
I was asked to review the medical records related to the case. These were medical records from Hennepin County. Then there were a number of interviews of people that were interviewed. I was given a long list of these, and primarily it was related to looking at a large number of different videos. But of course then the big part was that I needed to read on the scientific background of all the various aspects related to it.
So let's talk about your opinions with respect to this case. Have you formed an opinion to a reasonable degree of medical certainty on the cause of Mr. Floyd's death?
Yes, I have.
Would you please tell the jury what that opinion or opinions are?
Yes, Mr. Floyd died from a low level of oxygen, and this caused damage to his brain that we see, and it also caused a PEA arrhythmia that caused his heart to stop.
So he said he died from oxygen, but he didn't say it wasn't the drugs.
And by PEA, you mean pulseless electrical activity?
Correct. It's a particular form of an abnormal beat of the heart, an arrhythmia, a particular form of it.
Is this what some persons might refer to as asphyxia?
Yes, it has been called asphyxia. To me, it's not terribly helpful. It just, what we're really talking about is a low level of oxygen. Other people talk about hypoxia. That again is just a Latin term meaning a low level of oxygen. So all of this is just really other words for a phenomenon that is a low level of oxygen.
Have you formed an opinion to a reasonable degree of medical certainty as to what the cause is or was for the low level of oxygen in Mr. Floyd?
Yes, I have.
Would you tell us what that is?
The cause of the low level of oxygen was shallow breathing. Small breaths, small tidal volumes, shallow breaths that weren't able to carry the air through his lungs down to the essential areas of the lungs that get oxygen into the blood and get rid of the carbon dioxide. That's the alveoli at the bottom of the lung.
Dr. Tobin, using a short video that you prepared, help you explain to the jurors how oxygen gets into the lungs and the body, how we take in oxygen.
Yep.
I'm going to show you what's been marked as Exhibit 950. Can you describe first what that is?
So here we're looking at the lungs inside a body, and we see here that you can see the windpipe up at the top, the trachea, and then that splits into the bronchial tubes. And also you can see the diaphragm down at the bottom. And when the diaphragm contracts, there will be air moving.
The jurors can't see it yet, so I'm just having you just identify.
Oh, I'm sorry, terribly sorry. I apologize.
Yeah, I'm going to offer it, Your Honor. Exhibit 950.
950 is received.
Yeah. Please proceed. We can, we'll display it so the jurors can see it.
Okay, so now we're looking, and you can see the contraction of the diaphragm. That's the kind of pink area down at the bottom. We see air going down through the windpipe and then proceeding down to the bronchial tubes. And then it was going to continue down the bronchial tubes until it will reach out to the air sacs, which will be the alveoli. And now we're seeing that we're moving down here, and these are like the grape-like structures down at the bottom, and this is where all the action occurs. The oxygen goes across those air sacs, and also the CO2 goes across them, then it's expelled back out. So that's everything in a very rapid video.
So then what happened in the case of Mr. Floyd that relates to the shallow breathing that resulted in his low oxygen?
So there are a number of forces that led to that the size of his breath became so small. And so there are a series of forces higher up that are leading to that. And the main forces that are going to lead to the shallow breath are going to be that he's turned prone on the street, that he has the handcuffs in place combined with the street, and then that he has a knee on his neck, and then that he has a knee on his back and on his side. All
Calls for a conclusion on the knee on the neck. Was it on the neck, or he said it was on the neck? We haven't really determined that.
of these four forces are ultimately going to result in the low tidal volume, which gives you the shallow breaths that we saw here. And so the air will not be able to
I'm surprised he didn't mention anything about the drugs. Oh yeah, he's the prosecution witness. That's right.
reach those air sacs we just saw in the video where the oxygen is exchanged and the carbon dioxide is removed.
Doctor, is there a concept that in the respiratory medicine field known as dead space?
Yes, there is.
How does that relate to Mr. Floyd?
So if you think of the video back all the way until you saw those clusters of grapes, where you saw the blood vessels surrounding the alveoli, everything up to there is dead space. So as you're breathing in, you breathe in through your nose, your mouth goes down through your windpipe, down through the bronchial tubes, radiating out until it reaches the air sacs. Up till you get to the air sacs, it's all dead space. Because the reason we call it is because no oxygen can get across those bronchial tubes. No carbon dioxide can get across it. The oxygen and the carbon dioxide, the only place that gets across is those little grape-like structures. So everything in the lungs before that is dead space.
So you mentioned several reasons for Mr. Floyd's low oxygen, and I just want to capture those for the jury, and then we'll talk about them. You mentioned one, handcuffs and the street, knee on the neck.
Yep.
Let's get that out. Say knee on the neck a lot of times so the jury
Sorry for my
remembers.
writing, you know what, I didn't get an A in school. The prone position,
Yep.
and then the knee on the back, arm and side. Were those the four?
Yep. These are the four.
Okay. So we want to talk about each of these, but before we do that, might it be helpful for explaining your testimony to the jury for them to see the relative positioning of the various officers on Mr. Floyd's body when he was subdued on the ground?
Yes, I think that would be very helpful.
Did you assist in preparing an illustration to show the relative position of the officers on the ground?
Yes, I did.
And let me show you what's been marked as Exhibit 949. Could you just tell us, just
Right.
describe generally for the record what it is?
I mean, I watched the videos and certain segments of the videos hundreds of times, and it's very difficult to kind of get an overall view of where everybody is positioned because you're seeing different videos from different angles. And so the artist has taken all the different videos here and he's combined them into one moment in time. And you can see here, and also he will remove the police vehicle, so you're going to get a better view. So you're looking kind of at a bird's eye view of where Mr. Floyd is lying and where the officers are positioned in relationship to Mr. Floyd.
Right. So the purpose of this is to show the relative positions of the officers on the
Correct.
screen. Your Honor, we would offer Exhibit 949.
Any objection? 949 is received.
So what point in time, if you told us that this is at a particular point in time?
Right, it is a particular point in time. I don't remember the exact minute, second at the top of my head, but it is like...
That's 8:21 and 44 seconds?
That's exactly
about
correct.
right?
Yes.
First thing I notice on this picture, his neck is extremely elongated. In the actual photo of George Floyd, as you can see, his neck and shoulders, because he works out, is very small and short. This isn't a good picture, but there's a better picture. This picture here, you can tell his neck, his chin is almost on his shoulder. He doesn't have much of a neck, so his shoulders is much closer than in the picture we're seeing. Big gap.
What we're seeing.
Okay. Yep. Now you can see the car is being rotated. You're able to see Officer Chauvin, you're able to see Officer King, and then Officer Lane down at his feet. You see underneath Mr. Floyd, and now the car has been rotated. Now the car has been removed. And so you're able to see how they're positioned at different points. In terms of, with Officer Chauvin with his left knee on the neck, his right knee on Mr. Floyd's arm and chest, and then you can see here Officer Lane holding his legs, and then you can see Officer King with his knee on his torso.
So this represents a snapshot in time, as you told us. Did the officers' positions change over time as they were there on the ground?
Yes, the officers' positions changed over time, and also the position of Mr. Floyd himself changed over time, and these become relevant in how we evaluate everything.
And was it something you factored into your analysis then?
Yes.
Did you consider where Mr. Chauvin's left knee was during the encounter?
Yes. For Officer Chauvin's left knee is virtually on the neck for the vast majority of the time.
And when you say vast majority, are you able to be more
It's
specific?
more than 90% of the time in my calculations. There's certain times where it becomes difficult because you don't get a good view of where it is. So, for example, I know that an Officer Chauvin's right knee is on his back 57% of the time. The reason I'm not able to say for the 43% is that I don't get a good view. I can, other times, don't have a good view of exactly where it is.
So did you focus on the first 5 minutes and few seconds?
Yes, I focused on the first 5 minutes, 3 seconds, because that is up to the time that we see evidence of brain injury.
So if Mr. Chauvin's right knee was on his back from time to time, at other times it was placed where, in your observation?
It was placed on his arm and then rammed into Mr. Floyd's left chest. So really, whether you're making a distinction of whether the knee...
Rammed in. Man, that's a pretty aggressive... This guy isn't trying to help the prosecution.
...is on the chest per se, or whether it's on the left arm and rammed in against the left chest. From the point of view of breathing, the effects are extremely similar.
And of course, an officer in the middle of arresting somebody that's fighting him and under the influence of drugs should know all these medical terms and exactly what's happening in the physiology of the person that's fighting with him. Unlike you, who got to review this in your office and set up little diagrams.
Let's turn to the number one on the for Floyd's low oxygen, Mr. Floyd's low oxygen mechanisms, the four that biology or clinical medicine.
They don't have an awful lot to do with clinical medicine, but they are directly related to my work in physiology. So in understanding the forces that the body has to cope with, these are crucial in terms of the various forces that are involved in physiology.
So then turning to the first one in handcuffs and the street, the very first one. What is the effect of the handcuffs in the context of what happened to Mr. Floyd?
The handcuffs are extremely important in Mr. Floyd, but the handcuffs on their own, just handcuffs per se, are not that important. It must be the handcuffs combined with the street. And it's because of the positioning of the handcuffs at the back, then how he's manipulated with the handcuffs by both Officer Chauvin and by Officer King, how they manipulate the handcuffs, and they're pushing the handcuffs into his back and pushing them high. Then on the other side, you have the street. So the street is playing a crucial part because he's against a hard asphalt street. So the way they're pushing down on his...
Yeah, it's unfortunate. Cops should be carrying pillows around. So when we're fighting, we can lay a pillow down. Yeah, that's what we should do. This is what's called evaluating this in an unfair or unreasonable manner because it's nowhere near what the officer has to deal with at the heat of the moment in the middle of the fight.
His handcuffs combined with the street, his left side, and it's particularly the left side we see that. It's like the left side is in a vice. It's totally being pushed in, squeezed in from each side, from the street at the bottom, and then from the way that the handcuffs are manipulated. It's not just the handcuffs. It's how...
I guess in this doctor's world, you would never handcuff anybody and you would never lay them down.
How the handcuffs are being held, how they're being pushed, where they're being pushed, that totally interfere with central features of how we breathe.
So, Mr. Floyd Dennis.
And would he have been in handcuffs on the ground if he wasn't committing felonies and doing drugs and hiding drugs and fighting with the police? Oh, never mind. We can't ask that.
Is pancaked between the pavement underneath them and then forced on top of him.
Precisely.
Now, could you help us to explain how this mechanism, the handcuffs and the street, how does that explain the shallow breathing that you've described?
Yeah. So this gets back to how we breathe. And this is fairly simple. So the way we breathe, we have two big muscles that help us with breathing. We have the diaphragm and we have the rib cage muscles. The diaphragm does about 70% of what we need for breathing, and about 30% of it comes from the rib cage. And when the diaphragm contracts, or the rib cage contract, they expand the chest. And when you expand the chest, then air flows in from outside, and it's coming in. And that's all that happens on inspiration. But to expand the chest, there's two crucial actions that have to happen. And we refer to these by the terms pump handle and bucket handle. So if bucket handle is simple. So if you have a regular bucket that you carry water with, and you lift up the handle of the bucket, the handle comes up like this. And so when you contract your diaphragm, you are performing a bucket handle movement on the rib cage. So you contract your diaphragm like that, and each time as you inspire, you can see it yourself. As you inspire, each of you there in the jury, you inspire, you see that your rib cage is going outwards like that. That's a bucket handle movement. The second movement that you have is called the pump handle. And this reflects to an old water pump that would be in the yard for pumping out water. And so you have the handle at the top of the pump, and you lift up the handle of the pump each time, and the water comes out the spout at the bottom. So you're filling up, get your container of water. So with that action, you're lifting up here. This refers to the front to back movement of the chest wall. So with the pump handle, your chest goes out with each breath. And so you can do it yourself. As you take a deep breath, you can feel that front to back, you're expanding your chest. The front to back expansion of your chest is with your pump handle. At the same time, you're doing both of them at the same time. At the same time you're doing that, your chest is expanding from side to side, and that's with your bucket handle. So both of these are occurring, and these are vital. Without these, you can't breathe. If you don't have the bucket handle working and the pump handle working, there's nothing happening. There's no air going to get in there.
So, Doctor, do you have a photograph that you brought that would help to better understand the pump handle and bucket handle?
Yes.
Let me show you what's been marked as State's Exhibit 951. Do you recognize what this photograph depicts?
Yes.
Is it an accurate portrayal of a certain incident? Is that
Yes. Yes.
would it help you explain the testimony?
Yes. So this is an event that happened in England.
Dr.
Sorry,
Toby,
I'm
just
sorry,
one
I
moment.
apologize.
Yeah, I need to offer sooner, Your Honor. We offer Exhibit 951.
Any objection?
Oh, sidebar. Man, this guy, I've got it on 150. If you want to listen to all this in regular time.
Doctor, in this case, were you able to observe whether Mr. Floyd's breathing was impacted by the handcuffs and the placement on the street?
Yes, I was.
What did you observe, Dr. Tope?
What I observed is particularly is in terms of the hands of the police and the handcuffs, particularly on the left side. So they were forcing his left wrist up into his chest, forcing it in tight against his chest, forcing it high up. And you have to keep in mind that the opposite side of this is the street. So he was being squashed between the two sides. And so this meant that he couldn't exert his pump handle because, the street totally blocked his pump handle. There was no way he could do any front to back movement. And again, the way they were pressing in on the back, there was absolutely no way that he could do any front to back movement. Then in addition, because of the knee that was rammed in against the left side of his chest, sometimes the knee was down on the arm or in against the chest.
And he keeps using rammed. I'd call him on that as defense. What's your definition of ram? And explain to me when you're on a video where you see ram.
So this would have the same effect. So basically, on the left side of his lung, It was almost like a surgical pneumonectomy. It was almost to the effect as if a surgeon had gone in and removed the lung. Not quite, but along those lines. So there was virtually very
Oh my God! Now the cops removed his lung. Now this guy ain't in the tank for the prosecution.
little opportunity for him to be able to get any air to move into the left side of his chest. So he was going to be totally dependent on what he'd be able to do with the right side.
Have you selected any footage from the body-worn cameras that you feel depicts Mr. Floyd's struggles to breathe?
Yes.
I'm going to show you what's been marked as State's Exhibit
Here is on. Not see this. I'm describing what I'm seeing.
for now. Yes.
Yeah, okay, that's fine. What I'm seeing is that his left hand is being grabbed by the police officers. So that's a handcuffed left hand, and it's being pushed into his chest. So he's just not able to expand that. In addition, what I'm seeing.
I'm sorry. The foundation for it.
Oh, I apologize. I didn't.
So let's hold off and turn it
Okay,
back.
I'm
Thank
sorry.
you.
My misunderstanding.
Your Honor, we'll offer State's Exhibit 944.
Any objection? 944 is received.
All right. Now, Dr. Tobin, the jurors.
You're able to see here with the yellow arrow, you're able to see that the officer is holding Mr. Floyd's left hand.
This prosecutor can't figure out that he's got to publish these, and he can't stop the witness from testifying and say, hang on a second, let me push. He's got to let him go on and on, so we got to hear it twice. Wow.
He's holding it very firmly. There's a very firm grasp on it. And then Mr. Floyd's left hand is being pushed in against his chest. Also, we're able to see just on the side that Officer Chauvin's knee is coming in, and that's compressed.
This looks like the small of the back to me. I don't know how he gets the chest way back here. This looks like the hand's being pushed into the small of the back, but this expert's calling it the chest.
Pressing in against his side as well. So the ability to expand his left side here is enormously impaired. And also you're seeing that the size of the chain between the two, the right side and the left side, is very short. So his whole left arm is also being pulled over. And so it's preventing him also from expanding the right side.
Maybe he was trying to pull his arm that way, and they were trying to control him because they've only got two hands, and they're trying to control a bigger dude that's fighting on a side of a street. Maybe Floyd was pulling his hand that way, and the officers didn't put it that way, but okay.
Focusing on the bucket handle and the pump handle on the left, but you can also see here that these are impaired. His ability to expand his chest.
He is absolutely viewing this in the vacuum of how the body works and what's happening.
And of course, the key factor you must keep that isn't kind of in a sense seen here in one sense is the street. The street is what is having a huge effect because he's jammed down against the street. And
It's the street's fault. If we just had reasonable street control.
so the street is playing a major role in preventing him from expanding his chest.
Thank you. If you could clear the screen, Your Honor.
Dr. use these tiles if you need to use to draw on the screen.
Thank you.
Now, did you select another still image that you observed at...
Oh, jeez, this guy's freaking horrible DA.
Do you recognize this as this?
We all know why he's there.
What you're seeing is slightly different on the two images, but they marry together. If you look on the left side, you see his finger is pushing against the street. You also see the hands here of the officers around his left hand. You can see the left handcuffed arm. As we discussed, you're seeing a more clear view here, how it's been really rammed into the back of his back. There's just no way he's going to be able to expand that. But with this, the left image you see, and to most people this doesn't look terribly significant, but to a physiologist this is extraordinarily significant, because this tells you that he has used up his resources and he's now literally trying to breathe with his fingers and knuckles. Because when you begin to breathe with your rib cage and your diaphragm. Those are wasted up. Then you're relying on these types of muscles, like your fingers, to try and stabilize your whole right side, because he's totally dependent on getting air into the right side. So he's using his fingers and his knuckles against the street to try and crank up the right side of his chest. This is his only way to try and get air to get into the right lung.
You know, Doctor, showing you what's been marked as State's Exhibit 938.
Who knocked this tie off?
A related series of photographs and images.
Yes.
Your Honor, we offer State's Exhibit 938.
Any objection? 938 is received.
The bottom is just the blow up of what you're seeing on the top. And the focus on the left hand side is his shoulder. And again, as I mentioned, when you have difficulty in breathing, you begin with the diaphragm, the rib cage, you go on to the accessory muscles like the sternomastoid. One of the very last muscles that you will use is your shoulder. You don't really use your shoulder for breathing. But if you look here on the left hand side of he's taking a breath in, using his... He's breathing out. And it's the two of them are shown, so as you see the marked effect on the left. But again, you have to realize that the shoulder is a very ineffective way of breathing, because at that stage the chest is all so expanded. So when you contract your shoulder, because the chest underlying it is so expanded, you get very, very little area. It's a very poor way of breathing, but it's what you have to do when everything else is failing. When you're in extremis, you will call on the use of the shoulder to try and breathe.
So, Dr. Tobin, have we covered the first item, that is handcuffs on the street?
Yes.
So let's talk about number 2, the knee on the neck. Explain why the knee on the neck is so significant.
The knee on the neck is extremely important because it's going to occlude the air getting in through the passageway.
So is it possible, Doctor, to perhaps even demonstrate with an anatomy lesson?
Yes.
That may be relevant.
To understand the knee on the neck, you need to examine your own necks, all of you here in the jury, like I'm doing now. And so, the first thing is, if you put your index and thumb up here at the top of your neck, the first big thing you're going to find is your Adam's apple. And you can find the Adam's apple, and it's a very sturdy structure because it's surrounded by cartilage, and it protects the voice box, the larynx, which is essential for speech. And so any amount of compression on the Adam's apple is not going to compress it. This is an extremely strong, sturdy structure. It's not going to be compressed by a knee on the neck. Then you go down from your Adam's apple and you feel the little bumps beneath that. And these are the rings of cartilage of your trachea, or your trachea. So this is your windpipe here. And so that's, again, because of the cartilage there, a knee on the front of that part is not going to cause compression. Okay? But then bring your finger up to the top of your Adam's apple. And up at the top of your Adam's apple, you're now directly over the hypopharynx. And the hypopharynx is the crucial area in Mr. Floyd. So this here is where the hypopharynx is located on your surface anatomy. It's going to be an area that is compressed. It's extremely small to breathe through, and it becomes very important for being able to continue to breathe through.
Could you identify, just for the record, tell us what's depicted?
Yes, I'm looking at 937, which is the hypopharynx.
And then 935, there we go.
Pharynx.
The hypo.
937 I receive.
Exhibits 937 and 935. Could you help us to better understand?
Yeah, it does. So here where I've drawn in red is the top of your tongue. Okay, that's the tongue there. And then above it is an empty space. And then above that is the top of the hard palate. So that orients you there. And say then the tongue comes down along here. And the critical structure in this case, because the act of speech in Mr. Floyd becomes very important, how he was able to speak and all these different things. So the structure that gives the speech are the vocal cords right here. And they're in the voice box and in the larynx. And then we have a little area here called the epiglottis. It's a little sliver. And that comes back to prevent food going the wrong way when we're swallowing. Because we use the hypopharynx both for swallowing, for eating, and we use the hypopharynx for breathing. So when we're breathing, the air is going to come in through your nose or your mouth, go on down through the hypopharynx, then through the vocal cords and into the windpipe, into the trachea, and go on down into the lungs. Whereas when you're swallowing, that trapdoor of the epiglottis will prevent the food going into the air passages and will direct it into the food tube at the back of the esophagus. The area of the hypopharynx then is exactly from the base of the epiglottis, the first yellow arrow, down to the second yellow arrow, which is the larynx. And it's just that little area that is the size of the hypopharynx.
Could we see 935?
People, I have it here in the millimeters, 199 to 203, which are obviously difficult to remember, those type of millimeters. But in fact, right in the middle of this would be the size of a dime. So a dime is basically the size of what the hypopharynx, and it tells you how small and how vulnerable is this area. So if it's going to be decreased in size. Because the hypopharynx is going to be the area that will be vulnerable to occlusion from the knee on the neck. But in addition, the hypopharynx has another aspect, and that is the hypopharynx is also controlled by the size of your lungs. Relation of that's going on.
Was Mr. Chauvin applying force or pressure to the hypopharynx of Mr. Floyd that you observed?
At different times. It varied from time to time.
Directly, his full weight on Mr. Floyd's neck. Are you able to tell us what impact or effect that would have had on Mr. Floyd?
Right. If Mr. Officer Chauvin had placed his knee directly on the hypopharynx, just that area of the dime, and it never varied from there, and it kind of came in like a bullseye on that particular area, then you would expect that this area would become totally occluded. But he varied the position. Mr. Floyd varied the position of his head, and Officer Chauvin also varied the position of his knee. So it varied over time.
And if it had become totally occluded, then what?
If it had become totally occluded, within seconds you were going to drop the level of oxygen to a level that would be produce oxygen deprivation in the body, resulting in either a seizure or a heart attack, one or the other.
Do you have another photograph taken from footage at the scene that would help the jury understand this point?
Yes.
Recognize this?
Anything.
So if you're looking, say, on the one at the left, and if you look at me first before you look at that. So if you stick your finger in your ear, and you draw a line from the finger in your ear going down through the vertebral bodies in your spinal column, you can get a line going down, and you're looking at that axis. And that's what I've drawn in here with the yellow dotted line. And so if you look here on the first slide, you see that Mr. Floyd's nose, his face, is directly face down on the street. It's not at any angle. So the next thing is, again, don't look at the slide, feel yourself on your own neck.
This is pretty damning testimony, because these pictures kind of back up what he's saying. What it doesn't explain is that Mr. Floyd was under the influence of drugs and he was fighting the officers and they were trying to hold him down. But it can show that had they stopped what they were doing or recognized that he stopped breathing and took action, probably wouldn't have died, except from the drugs. We don't know if he was overdosing and dying. That's why, remember, this case has to prove beyond a reasonable doubt. So is this a contributing factor? Probably. But again, I just showed you where Steven Crowder had a guy kneel on his neck just like this, and he did a 10-minute interview. And he was handcuffed. And he had a second guy on him. And he was able to do a 10-minute interview. So, you know, there had to be other factors that caused this that the officers could not have known. Therefore, what they did at the time and under the circumstances was reasonable.
So the next thing is, again, and so where the bone of the skull ends, and then you come down from that and you'll find, and you put your whole palm of your hand around it. Sorry? So where the
Sidebar, man.
There's going to be far greater compression of the hypopharynx in this region here compared with what you were seeing on the left side. On the left side, there's no compression.
On the right,
Here that he carries, and then also you have to remove out the weight of his shin bone and his boot, and so subtracting out all of these, and then you can calculate the weight.
can you also
Okay, this is just getting so monotonous to me. If you want to go watch this, I mean, I've got it on time and a half, and I'm like, Jesus Christ. So I just want to get to the cross to see what the defense says.
The toe is off the ground, and there's no body weight sitting back. He's not hunkering back on his heels, so everything is directed down on his knee. In this place, his shin and his toe and his boot is playing no contribution.
I never saw both feet off the ground. Never saw both feet off the ground. In his drawing, it shows both feet, but in every other picture, his other foot's on the ground, which would indicate he's leaning on his other foot and putting half pressure here. Okay, I'm going to end this one and then come back, hopefully, with the doctor on cross.